If you need medical care, are you going to be covered? And if you are you going to be bankrupt for the rest of your life? Are there going to be enough resources to take care of you? Or are you going to be one of the people that's just turned away? We all have these questions. And people have asked me in the book, why do you equate war stories from Iraq with healthcare in America? And if after the COVID crisis that we've gone through and are going through, if you don't see that healthcare is in a state of war with mass casualty situations, I don't know what to tell you, except get educated. The book is about expanding your mind, challenging your preconceived notions. So if you're brave enough to actually want to learn, read the book, do your own research. Because make no mistake about it, the casualties that we face from healthcare every day in America, regardless of COVID, are unacceptable and they are avoidable. We can make a better system for our citizens. But make no mistake, we are at war with our healthcare in this country. What are you going to do about it?
You know, Reagan, as you and I were talking about your book, and as I was reading your book, I was struck by the very, very stark, eloquent, disturbing scenarios that you drew about your experiences in combat. I think people reading the book are going to be very surprised at the things that you have to say that you went through, that your patients went through, that your Marines went through, that innocent Iraqi civilians went through in wartime. But even though that's very compelling and it's very important for people, especially people that have never been to any kind of combat, to be able to read and experience vicariously through that reading what you experienced, how does that really relate to care, civilian care, in a civilian society in America?
So that's kind of chapter 1. And yeah, the stories are gripping and they're compelling, and sometimes they're very hard to go through or read through. They were hard to live through. But about a month ago, I had a ruptured appendix. So I went to the ER and I was in pain. I was in a lot of pain because I had sat on it. I thought I could walk it off. You know, the Marine in me said, oh, just walk it off. Well, it turns out you can't walk off a ruptured appendix. And so I'm in there and I'm being poked and prodded and CT scanned and all these things. And then I'm being rushed off to surgery. Now, that experience in that cold bed, in that cold room, with your life completely in somebody else's hands, you have really little to no control over, is very similar to being dropped off in Iraq in a helicopter in the middle of a combat zone and being shot at. Yeah, bullets weren't flying at me, but bacteria and infection was filling my gut and was trying to take my life. And so I think both situations are kind of extreme. Flying into Iraq, going to war, and your appendix bursting and having your belly being consumed with infection trying to kill you. And you're out of control in both scenarios. And that's what we have to realize. People who are listening to this have to realize that at some point you've either gone through it, you're going through it, or it's coming around. And you will need health care in perhaps an extreme fashion. And you will have no control over that. And that will be a life-altering event. Now, when I was in Iraq and landed in that field and dust was everywhere and I lost my way, well, very similar to being in a hospital bed, very confused, going into septic shock, about to die, and having somebody cut my belly open to try to save my life.
Yeah, but surely, Reagan, in the hospital here in the United States of America, surely there was a team of very competent professionals. Surely their medical training, the pharmaceutical industry, the insurance companies, surely all of those people were working on your behalf, right?
Yeah, I do believe that they were working on my behalf, just like I believe when I finally got to Recon Battalion and they welcomed me there, that we were all a team marching forward in a common direction. We didn't know what the future held in Iraq for any of us. When I woke up from that surgical bed and I got my wits about me and I was walking down the hall, my thought was, okay, I'm relatively young, very healthy except for what just happened, and now I need to recover. I have a good job and I have good insurance. What about the people who don't? What about the vast majority of Americans who have high deductible plans, with not very good benefits and do not have, and let's be honest, do not have a physician's salary. As they're walking down the hall trying to recover and in pain, tubes out of themselves everywhere, how many of them are thinking, can I afford this? Will I be able to afford my mortgage and this? Or will I be one of the huge numbers who are going to go into bankruptcy because of medical bills, because they're out of control? The analogy between Iraq and healthcare in America breaks down at some point. But there's enough commonalities that I think if people see the uncertainty in Iraq and the uncertainty when they need medical care in America and how much is completely out of their control when they're in that vulnerable position, I think they'll be able to draw the parallel.
Well, would you agree that the people that make healthcare policy, the insurance companies that determine what they will or will not reimburse physicians for or patients for, the pharmaceutical companies, would you agree that they all have really your best interest at heart?
No, I think the physicians do. I think the medical professionals do, the nurses, everybody that goes into the care, actual physical care. Everybody else is making money. And that's okay. We live in a capitalist society, and I think capitalism, for the most part, when it has some checks and balances, reasonable checks and balances, I think that's the best way to approach most things. The problem is that, for pharmaceutical companies, they released a thing a couple of years ago, I write about it in the book, that talks about, well, as long as you only increase your prices by about 10% a year, then that's a reasonable increase. Why? Why is that reasonable when inflation's 1% to 2%? Why is it reasonable when, if a medication's been out for 20 years, all of your research and development costs are covered and it's enormously inexpensive to produce medications? Why is just 10% a year reasonable? And then there's lots of examples where pharmaceutical companies have increased their prices 1,000% over the last couple of years. 1,000! When all the research and development have been covered, manufacturers gotten cheaper because it's been out longer, fill in the blanks, it's turned generic, all these things, and even generic. Now the generic companies realize, and oftentimes cost more than the branded drugs because they're playing the game. What are you going to do? You're going to die? You remember the EpiPen thing, where they just kept jacking up the price for EpiPen. And EpiPen is a medication that you deliver if you're going into an asthmatic attack so you don't die. It delivers epinephrine to you. Well, they just kept jacking up the price and jacking up the price. Because what are you going to do? You're going to let your kid die? And so the insurance companies, the pharmaceutical companies, all of these big industry, their mission is to make money, not health.